Health Virtual Town Hall. I'm Tammy Weicker, Adkins Public Information Officer for Tulare County Health and Human Services Agency. And first of all, I have to apologize. We were having technical difficulties, and we hope that the questions that are answered here tonight will make it worth your while for joining us. But again, we do apologize for being late in starting. I'd like to introduce our panelists who are here to answer questions from our community this evening. First, let me introduce Karen Elliott, Tulare County Public Health Branch Director, Dr. Sharon Minnick, Tulare County Public Health Epidemiologist, and we have the Chairman of the Tulare County Board of Supervisors, Pete Vanderpool. Welcome, panelists.
Thank you. Thank you, Tammy.
Now we'll begin by giving each of the panelists a moment to give a first statement, and then we'll ask our questions that have come in from our town hall email and from social media, and we'll give each of the panelists an opportunity to give a final statement after that. So let's start with Pete Vanderpool.
All right, thank you very much, Tammy. Good evening, residents of Tulare County. As you are all well aware, there is a worldwide pandemic at this time, the coronavirus, also known as COVID-19. I want to assure you that during this time, county public health officials are working around the clock, pulling resources and acting to keep the people of Tulare County healthy and safe. I want to thank Tulare County employees for all of their diligent work to keep the public safety and welfare at the forefront of all of our attention and priorities. As soon as the first positive COVID-19 cases were confirmed, the county proclaimed an emergency declaration on March 11th, 2020. This emergency declaration allows for the county to request additional resources, supplies, and funding from the state to help us effectively respond. I also want to assure you that we continue to provide services to the community. This includes county programs that impact older adults and their caregivers, child care providers, low-income families, and people with developmental disabilities. The Tulare County Board of Supervisors and our partners are asking you to be prudent and sensible as you shop for supplies. Many stores have empty shelves, and they are trying everything they can do to restock them. I ask you, please avoid overstocking in an effort to allow our local vendors to replenish their inventories. Because we need to get supplies to those who need it, especially our most vulnerable populations. This includes individuals who are 65 and older and people with medical needs. Please keep them in mind as you shop, and let's all try to avoid unnecessary overstocking. As this situation expands and we continue to implement protocols to protect our communities, let us remember that we are all in this together. We all have an important part to play in keeping ourselves and our community safe. This is a good time to practice kindness towards others, and in general, be courteous and polite. Take this time. Check on your neighbors, family, and friends. I ask you to be flexible and follow health recommendations. Be vigilant. Wash your hands, cover your coughs and sneezes, practice social distancing, and stay home if you are ill. It is our responsibility to be and stay informed, and also to get reliable information. Some resources for such information include our very own Tulare County Health and Human Services Agency. Please go to their website at tchhsa.org. Follow them on Facebook and Twitter. Other reliable resources are the California Department of Public Health and the Centers for Disease Control and Prevention. Now I want to turn it over to our health experts so you can hear directly from them necessary information.
Thank you, Chairman. The Public Health Branch has been following the COVID-19 situation since early February. We have coordinated and gotten information from the state and the Centers for Disease Control. Our initial efforts were in working with organizers of the World Ag Expo We coordinated with them to reach out to those traveling from overseas, creating messaging and signage, and basically reaching out to the businesses and hotels to provide them information as needed. The Public Health Branch has opened what is called a Department Operations Center. This is an operations center that operates 7 days a week. Its effort is to pull experts in the different programs at the agency and county to focus solely on this emergency and leverage resources throughout the agency and wider county. Through this operation, we can coordinate we could keep up on current active investigations, coordinate messaging out to the residents and community, order supplies to be distributed to the hospitals and medical providers and first responders, and collect data on the cases and on the tested and monitored individuals. We have developed frequently asked question sheets and developed informational videos that we have placed on Facebook and on social media. We have coordinated the call center to field questions from the public and our medical providers. I do want to share with you that the Public Health Department did get informed today of another positive case. We now have 4 positive cases. This individual had traveled outside the U.S. and returned on March 13th. They have been at home self-quarantined since returning home. This individual did contact her medical provider, made arrangements to have the testing that was provided to the public health lab, and now has begun to self-quarantine at home. We are now beginning our investigation and will continue to share information as it is received. We recognize the community looks for information and guidance during this time, and we will continue to share information as it is determined. Please reference our agency website to get daily updates on cases and information. The public safety continues to be our top priority, along with supporting those who have tested positive and the contacts who have been identified. I'm going to turn it over now to Dr. Sharon Minnick.
Thank you. As our director mentioned, we now currently have 4 cases of COVID-19 in Tulare County. Of those 4, 3 are in self-quarantine at home with mild illness, and 1 is in the hospital with acute illness. Tulare County has 53 individuals in the county who are in self-quarantine, besides the cases. These 53 individuals, 12 of them have traveled from outside of the county or outside of the country, and 40 are individuals who have been identified through our contact investigations as being possibly exposed to a case. These numbers will fluctuate daily, and they don't include all of the contacts from the active contact investigations of our most recent cases. So you can expect to see these numbers go up or down depending on whether new contacts are identified or people have completed their 14-day quarantine period for travelers and contacts. We did have a higher number on our website yesterday, and this was because we were also including some people who were being assessed by our public health department, but they were not actually travelers or contacts. So the numbers may seem a little lower today, but that's because we are now trying to specifically concentrate on the true travelers or contacts that we have identified. I'd also like to talk about some of our testing numbers. We're very lucky here in this county that our public health lab here in Tulare County is a regional reference lab for our region, from up in around Mariposa and Merced down through Kern County. Our lab has tested 69 patients from Tulare County and 69 patients from the other counties in this region, for a total of 138 patients tested through yesterday. So today they've done even a few more. Our public health lab, providers can also obtain labs now through commercial laboratories. We're not able to track those numbers, but we are informed if a result comes back positive. We would like everyone to keep in mind that the public health lab gives the test results to the provider, and the provider will give the result to the patient. Also, testing should be arranged through your healthcare provider. It cannot be conducted at one of the public health laboratories or a commercial laboratory directly. You need to speak with your doctor. We are putting out a guidance for people, and you'll be able to find this soon on our website, which is a schematic which will help you to decide whether you need testing or not. And this may come up some more during the questions, but that's something to look for very shortly, and it will help you determine how to obtain testing if you should need testing. We spoke a little bit about contact investigations. This is something that public health does regularly. We have to do this also for COVID-19, and we follow the usual procedures. It's rather a difficult procedure, as you might imagine. So who here can tell me exactly who they came in contact with 7 days ago? So we have to question people pretty detailed to find out all the places they may have been or the people they may have contacted during that time. But this is what public health does, and we've been doing this for a long time with other diseases before, such as measles. I also wanted to talk a little bit about the medically fragile people. These are people who may have had a chronic illness, such as heart or lung disease or diabetes. They may be immunocompromised for various reasons, such as cancer treatment, or they could be of older age. We know from the data coming from China and other countries that people of older age, such as those over 60, 65, and especially those over 70 or 80, are at greater risk for severe disease from COVID-19. So I also wanted to talk just a little bit about the difference between isolation and quarantine, and self-isolation and self-quarantine. So technically, isolation is for cases who are potentially contagious to the community. Quarantine is for people who've been exposed to a case or a high-risk area, and it's to protect the public from being exposed to these people should they become contagious themselves. Self-isolation and self-quarantine simply means that people are being asked to stay home if they meet any of these conditions, such as travel to the high-risk area or being a contact to a known confirmed case. Self-isolation was a term I believe the CDC started using, especially in reference to the travelers, because a traveler is not necessarily someone who's had contact to a known case, but we were still asking them to self-isolate themselves. And in terms of steps that we can take to help reduce infection rates, these are all the usual public health guidance that I'm sure you're hearing all about, that we also tell everyone about during flu season, such as washing your hands, disinfect frequently touched surfaces, stay at home if you're sick. We're also really emphasizing now the practicing social distancing, and also, again, our public health contact tracing of cases and isolation and quarantine. So I think that's it for my
All right.
Good information.
Thank you so much, panelists. So now we'll go to our question. This question is from social media. Now, Dr. Minnick was just talking about self-isolation and self-quarantine. But Karen, we talked about the difference between that, but does that mean that someone is guarding these individuals while they're at home, or are we just taking their word for it?
So when somebody is put at home on self-quarantine, typically if they're a contact or maybe they are a case, we have our public health nursing that provides them information. We provide them with all the types of documents so that they can monitor their symptoms every day. So if you are there because you're a contact, for the next 14 days, our public health nurses will be calling you up, asking you if you have any symptoms and asking if you have a fever. In terms of guarding them, we don't guard them, but I do want to emphasize, if it became necessary, the health officer does have the authority to enforce that and would take whatever steps is needed to make sure that they are following the self-quarantine and self-isolation.
Thank you. This question is from Christina. She asks, my parents are 73 and 76 years old. My father has a compromised immune system. Is it safe to bring my 6-year-old over to visit them?
And again, I think we have to look to the guidance that has been put out there, and you need to consider and weigh your risks. If your parents are really medically fragile, you may want to really consider that and Is it necessary to have in-person visits at this time? You need to look at where your son has been recently or daughter, whether they've been in school or not. But also consider if you might be able to implement technology solutions. So could you do a FaceTime visit or a Skype visit with your parents instead during this time?
This question is from social media. Why can't we know all the locations positive individuals have accessed? And I think this person means individuals who have tested positive for COVID-19.
Yeah, the answer to that is we typically don't know right away. We have to start our investigation. I know it's difficult at times, people want to know, but we have to do the investigation of when they became symptomatic and the places they traveled to. In the first case that became positive, we did, after investigation, find that he had traveled outside of LA County. And in the second case, we had found that the individual traveled out of Santa Clara County. Both of these areas had very high cases of positive COVID-19. So I know it's hard, people want to know, but what we do is, again, we look at all the contacts they've had since they became symptomatic and do our monitoring of that and do our investigation to make sure that we can continue to keep the public safe.
And this is, again, something that public health has been doing for a long time, and you may have seen in the past some public notices about, say, for instance, a measles case that might have been at a shopping mall on a certain day. And so this is what we would do. If through our contact investigation we determined that one of our cases had been in a public venue, possibly exposing people we couldn't track down during their contagious period, then we would put out a public notice.
From Colin, at the March 16th coronavirus press conference, President Trump warned against gatherings of over 10 people, and also that any states that are experiencing community spread should shut down bars and restaurants to limit the number of cases of COVID-19. In light of those guidelines, when will Tulare County pass regulations to that effect? Allowing bars and restaurants to remain fully open is dangerous for both the public and the employees who serve them.
I'll take that one, Tammy. Real quick, there's federal and state guidances that encourage people to remain at home and to only go out when necessary for necessities, being out in public. That kind of deals with the general guidance, and I hope that people do abide by that because it benefits all of us. Additionally, in terms of restaurants, I think it's a very safe practice. We've all received communications from many restaurants that we're all affiliated with in our own private lives who have said they've increased their sanitizing of frequently touched surfaces. They have closed down dining areas and are encouraging people to grab and go. In addition, there are numerous facilities that do accommodate diners but practice social distancing, etc. And this is hot off the press. Effective immediately, Tulare County Health Officer Dr. Karen Hott has ordered the closure of all bars in Tulare County in an effort to protect the public from exposure to COVID-19. This order is currently being implemented by county officials and our local law enforcement agencies. I ask the people of Tulare County to heed Dr. Hott's order. We understand it is St. Patrick's Day. However, we are asking the public to be vigilant and to refrain from mass gathering. I repeat, this order is effective immediately and will remain in effect until there are changes to our local health emergency declaration. Thank you for your understanding and for heeding this order.
This is a question from social media. What does social distancing mean?
Social distancing has become the term that's being heard around the world, it seems like. What it is placing, amount of distance between you and another individual. We typically say about 6 feet. The purpose is that to limit your time together and to put the distance between you so that you can protect against the spread of the virus. Although I know right now everybody is concerned, they want to be out, they want to do these activities, the thing is the more that we can prevent the spread, the better. There's a lot of people who might be at a younger age who are able to have symptoms of this or recover from something like this, but we have to do it so that we eradicate this in our area and so that we're not spreading it to the vulnerable population. So as much as I know that people want to be out there, they want to be getting together, they want to have the gatherings, what we're trying to do is keep that distance so we can slow down the spread and begin to see this slow down.
And we realize that we're not
Right.
quite a 6 feet distance away from each other, but we're hoping with our next town hall we can put some different things in place. And this is also a question from social media. What is the county doing about COVID-19?
So I'll take that. As we said earlier, or as I said earlier, we currently have a operations center that we are operating 7 days a week. We continue to communicate and message out to the community about what's going on. If we receive any cases, we continue to do the investigation. We continue to push the universal precautions that we always do, even when it's the flu. You know, cover your cough, wash your hands, you know, don't go out if you're sick, avoid people who are sick, and most importantly, one of the other things we do is what I think Dr. Sharon Minnick talked about earlier, and that is the contact tracking. So again, once we find out that somebody has been tested positive with COVID-19, we are getting a hold of the contacts that they've had, we are having them self-quarantine, and we continue to follow through so that we make sure and monitor them so that if any other symptoms occur that we can also continue to treat them and make the county safe.
Thank you, Pam. This is a question from social media. I work for a surgery center that is 95% of our surgeries are elderly having elective surgeries. What is the recommendation in regards to continuing cataract surgeries or other surgeries like that?
So the American College of Surgeons and the CDC have issued guidances recommending rescheduling or canceling non-essential surgical procedures, and this would definitely apply to most types of surgeries such as elective cataract surgery. Especially when you're talking about an elderly population, this would help to protect the vulnerable population, as we know the elderly are more susceptible to severe disease from COVID-19. It can also help us to be able to mobilize more healthcare resources should our number of cases increase. We know from the experience in China and Italy and other places around the world that if the disease really takes hold here, we're going to need all of the healthcare resources we have to treat patients who are experiencing severe disease. So we need to really free up all those resources for our hospitals.
Now this question is from Martha, who asked, what would be your recommendation for an employer whose worker traveled to Los Angeles last week in terms of returning to work? Employees stayed mostly with family and avoided public places. Looking forward to hearing your advice.
I'll take that one, Tammy. So I myself actually traveled last week to Washington, D.C. and to New York, and then returned home and before I went back to work, made sure that I did not feel any symptoms or any effects of my travel. Wanted to make sure that I took all the appropriate precautions before I went out and interacted with members of the public or fellow employees. So I would encourage that same effort. I hope that that employee exercised all guidance from the Tulare County Public Health and from the Centers for Disease Control in making sure that they sanitized surfaces, washed hands, and maintained social distancing, all of the necessary precautions to keep one healthy and safe. So as long as that employee is feeling well and is adhering to the guidances, I believe that employee is fine to return back to work.
This is another question from social media. The county declared a state of emergency. What does that mean?
Well, I will take that one too, Tammy. The county actually declared a state of emergency on March 11th, and the reason that we declared the state of emergency, it was immediately following the confirmation of our first COVID-19 case here in the county. While our efforts in preparation for the potential presence of COVID-19 began on February 6th, and early in February we began laying out the plans. We knew that if we did have a formal case, which we did on March 11th, we would declare the emergency as necessary in order to maximize the resources, both in supplies and funding, that we could bring from our state and federal governments to help support the efforts of county staff and personnel in combating the spread of COVID-19 here in Tulare County.
This question is from social media. The county declared, this is also from social media. Did the county have an emergency plan prior to COVID-19?
The county does have several emergency plans. So anytime even there is a fire or a flood, when we open our emergency operations center, they follow the emergency plan. And for public health, we do have emergency preparedness. It's to combat anything such as we're going through right now. We typically do a exercise annually to exercise the plan and see how it works. We unfortunately had to jump into it this year and do it actively, but because we had the plan in place, we had a lot of things that we were able to follow. We are able to look at the changing technology to assist us in this. We update these annually, and so having that is what prepared us to open our operations center and continue to serve the community right now in this effort to combat COVID-19.
Thank you, Karen. This message was from Vanessa through the town hall email. What does this mean for Valley fever infected patients if they get COVID-19? Since the Valley is the epicenter for Valley fever cases in the state of California, and so many people here have lung and breathing issues due to the poor quality of our Valley air.
That's a very good question. The general answer is that if you are currently suffering from valley fever, or you have any type of breathing or lung issues, you probably should be considering yourself to be at higher risk for possible complications or more severe disease from valley fever. From COVID-19. Sorry, but the specific answer is that we really don't know. The other countries around the world that have had the most COVID-19 cases do not have valley fever. So this is new territory, and we cannot really say specifically yet.
This is a question from social media. This individual works in a salon as a manicurist, and she says, we have been sanitizing and hand washing constantly. Recently, with all the changes and having to stay away from each other, where does that leave those of us in the beauty industry?
Well, I will field that one. I like to think of myself as a beauty expert. I think the general guidance from the CDC and from our public health agencies is very prudent, and it sounds like you're already following that with sanitizing, washing hands, et cetera, et cetera. However, one thing that I do think you can do in addition, you can practice the social distancing as much as you possibly can to maintain a distance between yourself and other clients that you may not know. But for those clients that you do know and that you are working with, ask them about their health. Ask them how they are feeling today, and if they're not doing well, maybe you should ask them to reschedule their appointment and come back for your service or procedure at a different date or time. I think that would be very prudent and help to prevent the spread of this very contagious disease.
This question is from social media. What does pandemic mean?
So a pandemic is an epidemic that involves either most of the world or all of the world. So what is an epidemic? An epidemic is actually more cases of a disease than you would expect in a given place in a given period of time. So that seems like kind of a funny definition, but if you think about it, it makes sense. If you always have a certain number of chickenpox cases, then that's not an epidemic, even if you have 100 cases. If you have 100 cases every year, that's just your normal rate of the disease. However, if you have never experienced COVID-19 cases and now you suddenly have 100 cases, that would definitely qualify as an epidemic.
Thank you, Sharon. This question is from Kay, who asked, can the website and email communication include updates with not only the number of people infected, positive cases, but also the recovery status of those people? We need more good news about recovery.
Sure. I think that we will be doing this as appropriate. Our cases are actually very recent and they're still in the process of recovering. but we will be posting those cases, I'm sure, with your help, Tammy, as they are appropriate. I would point out that there are some sources out there on the web for other regions such as the world. I think the Johns Hopkins dashboard, which we may have a link to on our website, does actually show numbers of people recovered across the world.
This question is from social media. How about undocumented immigrants in the community and their fear to access services?
This is a common question for all services, I think, in the community, and I understand that they are concerned. If there is no immigration status taken or anything when you are tested, if you feel that you show the symptoms of COVID-19, if you have a fever and you have a cough or breathing difficulty, please contact a medical provider. They do not collect that type of information. All that will be collected is your specimen that will be sent to the lab, and from there we can determine if you're positive or negative.
This question is from social media. What steps are being taken by the public health branch to help reduce infection?
So the public health branch, again, we want you to practice universal precautions such as washing your hands, covering your cough, staying away from anybody who's sick or staying home when you're sick. We've been also providing a lot of guidance out to the community in terms of cleaning. So, remembering to clean your surfaces often. And then it goes back again to we do continue to monitor all of those who are on self-quarantine. We monitor those who are on self-isolation and recovering from the virus, and we continue to do our investigations in terms of contact tracking in order to make sure that we inform any individual who may have come in contact with somebody who's positive.
This question is from Brianna. She says, I work in Kern County but live in Tulare County. Will there be a quarantine for the county? I see that several California counties are beginning to implement that, and I want to be sure to stay home if I need to.
Brianna, thank you for that question. It's a very good question, but it brings me to the notion that we live in a state of 40 million people. This state is comprised of 58 very diverse counties. There are urban counties, there are rural counties, and in the urban counties, the population centers are very dense. It is very difficult to control disease and infection in a very small area with a high concentration of people. Fortunately, we live in the San Joaquin Valley where the population is not as dense, and we do not have the same ease of spread as highly dense urban areas might. I think that we have taken the appropriate precautions here in Tulare County, but again, let me reiterate, this state is diverse. Not one size fits all. I think a lot of policies that come from Sacramento are directed towards what would benefit a majority of the state, but remember, this state is very, very diverse and includes areas that are not all like one another. So thank you for that question.
This is from social media. If I have not participated in the mad rush to stock supplies, what steps should I be doing to be prepared?
So in public health, we always feel that you should be prepared for any type of emergency. The recent stocking of all of the different items so that they clear the shelves is a little bit more than probably you need to be doing. I want to make you aware that even those counties that are currently shelter in place, what they are sharing is that essential services are still provided. So please be aware that essential services means access to groceries, medical care, prescriptions. So we always say, again, to be prepared, you should have some type of items. So if we do have a public safety power shutdown, or we have any other type of thing where we are without power for a while, you should have a good supply. But please be aware that even in difficult times that some of the Bay Area is facing right now, they are able to go out and do grocery shopping and get food when it's needed. So please don't continue to buy up all of the supplies. Allow other people to be able to do their grocery shopping.
Now we have several questions that were sent in by one person, Amelia. Thank you very much for sending in your questions to the town hall email. If someone tests negative, isn't that only good enough until they encounter a carrier? Isn't this just a useful snapshot in time?
Yes, that's actually a very good point, and that's why we're not doing widespread testing of asymptomatic people here, because that doesn't tell you that someone won't develop symptoms or become infected later on. So it only, exactly as the questioner asked, it's a snapshot in time. And when you see our testing guide, you'll see that it really does focus on either asymptomatic people.
Can Tulare County direct major shops such as Costco to create a pre-order or curb pickup service?
I will gladly take that because I know myself and my family would utilize that service if Costco had a curbside pickup service. Tulare County cannot order that to be done or made available by various businesses. I know that there are numerous businesses that do offer curbside pickup. I think that there's a lot of people that do avail themselves of that and go to the Walmarts or Targets of the world that do have the curbside pickup. But as of this date, Costco does not, and Tulare County cannot force them to provide that.
Lack of toilet paper is becoming a hygiene emergency. How can we remedy this?
So I think that goes back to buying supplies that you really need to have on hand in a regular type of emergency. Back to, essential services are always going to be provided even these times, and so you are able to go out and get any type of supplies. So I would just say that if you have plenty of toilet paper to get through the next couple weeks, please leave what toilet paper is being restocked for others that actually are in need.
The Sequoia Community Center in Badger Foothills serves many in the at-risk population of over 65 and or disadvantaged. Shopping in town is a 3-hour round-trip health risk. Can we organize a grocery delivery to the center for people to pick up?
It's a great question. I know that we do have several geographically isolated communities here in Tulare County, but while we do not have organized grocery delivery, I do serve on the Kings Tulare Area Agency on Aging Governing Board, and I am very aware, we had a meeting yesterday, that our senior centers that have offered lunch programs within their centers but are now closed have made those services available to regular attendees through the frozen meals program that others are regularly enrolled in. So not only are the regular enrollees receiving their frozen meals and Meals on Wheels, hot meals delivered to them in some cases, but they are also accepting additional enrollees who may have frequented additional senior centers within the community. So what I would encourage you to do if you do live in a geographically isolated community is to contact 211 or the Kings Tulare Area Agency on Aging directly at 1-800-321-2462. I hope that answers your question.
This question is from Lisa, who asks, is that if my spouse or I were to show symptoms, we know to self-quarantine, but for how long before testing, and how are you supposed to show proof to an employer that you have been quarantined?
Thank you for that question, Lisa. In terms of the quarantining, if you're showing symptoms, as I mentioned, we will have guidance for the public on when you need to go and get testing. And during that process, you'll also be advised on how to self-isolate or self-quarantine. There is CDC guidance that just came out yesterday about how long a person needs to stay in quarantine after they begin to recover. It's fairly detailed, so I'm not going to go through all of those details right now, but we do have that guidance and we will be working through that with our current cases as they recover.
Great. Thank you, Sharon. We have a couple of questions from Alice, and we kind of went over this a little bit, but let's just see again. When exactly do businesses have to close down?
That is a general question that I think that we touched on a little bit earlier, and there really is no mandate for businesses to close down, except for bars, as I did mention. Businesses are allowed to stay open, and in fact, many businesses are suffering right now. This is a very difficult time when your customer base is restricted in any way, shape, or form. So I do not foresee any additional mandated closures, and businesses are able to stay open, but for the health and well-being of both your employees and your patrons, please do practice social distancing, the sanitizing of all surfaces, washing hands regularly, coughing into your arm, sneezing into your arm, doing things to help control the spread of any infection.
How many can be in a building now? I see 250, 150, and now 10. Which is it?
There have been various guidances provided to the public, ranging from 250 individuals now all the way down to 10. And I think that the guidance has changed based upon the propensity or the likelihood that this disease will spread. And so we're seeing that number reduced. The general guidance is avoid assemblages of people. Try to stay away from close contact with other individuals whom you may not be aware of them being sick or maybe having traveled outside the country or into a county that has a high frequency of COVID-19 cases.
What is considered a gathering?
Well, a gathering is more than one person. As I have said, the guidance continues to change. It was once 250 individuals and is now 10. I know the county has already encouraged and canceled all assemblages of people that are not essential. So if the assemblage of people is not essential, I would encourage you in the public to forego that as well.
Adventure Park is still open. Can they only have a certain amount of people in the building?
Well, the food operations at Adventure Park will fall under the same guidances as for other restaurants and other food operations. Otherwise, I think people should use their own judgment based on what parts of Adventure Park they may want to visit, especially depending on if they have any pre-existing conditions or other vulnerabilities to this virus. Also keep in mind that there are indoor as well as outdoor sections in Adventure Park, so perhaps a game of miniature golf where you're keeping some distance from other families out there could be a good way to spend some time with your children in the outdoors, not getting in too close of contact with other people.
This question is from Elizabeth. She would like to know, what might Three Rivers expect in terms of national park accessibility to visitors?
Well, Three Rivers is absolutely a gateway to one of our tourist hotspots here in Tulare County, and that is the Sequoia National Park. And we do have direct guidance from Woody Smeck, who is the superintendent of the Sequoia Kings National Parks, and he has encouraged people to come up and to check out some sequoias and come enjoy all of the parks have to offer. There's a lot of great natural experiences in our parks, whether it's trails, whether it's trees, wildlife. There's a lot to see right here in our very own backyard. And while you have this time with your child outside of or not in school, and you may not be at work, please do feel free to venture up to the Sequoia Kings National Parks. They will welcome you with open arms. I think that the number of visitors is probably down right now, and so it could very well be a good time to go up there and maintain social distance, but do enjoy all that the park has to offer.
This question is from Christina, and she would like to know, can you tell us how recent events will impact outpatient mental health providers and clinics in Tulare County? Will those programs remain open and providing services to the public? And at what point would you give direction to close them?
That's a really great question, because I know this is part of the population that we're very concerned about during these times. These uncertain times can really increase the anxiety level. You know, here at Tulare County, we have a mental health branch, and you know, they're looking closely at ways to observe the direction and guidance that we've received in terms of having people together in a building and still reaching these individuals. So they're looking at telemedicine, they're looking at phone calling, they're looking at video, phone type messaging. So, we continue every day to assess what the direction is, and they know that these individuals are important for us to continue to check in on and to continue to provide those services. If anything, I think she asked if anything closes, anything that would impact any type of county service, we would be notifying the community as soon as possible, and we would be listing on our website. But I mean, at this point, they will do whatever they need to be creative in terms of providing those services to those individuals that really need it.
Thank you. This question is from Andrew. He feels as though Tulare County is a little bit behind other counties and would like to know if we believe that's so.
Well, Andrew, I will gladly take that question. I do not believe at all that Tulare County is behind any county. As I mentioned earlier in my comments, we began preparations as a county for COVID-19 before the first case even came to the state of California. We knew that it was going to come. It was only a matter of time. So we began our preparations very early in February 6th to be exact. So we wanted to make sure we were able to hit the ground running to protect not only our county services, but also the general public. And so I think we've been very proactive. When the very first case hit Tulare County, we immediately declared a state of emergency, and that was on March 11th. And I think we've taken every precaution to help control the spread of this highly infectious virus. Some of the specific items that the county has done, I want to go through this with you. The county library and museum are closed now through March 31st, 2020. We have taken measures to decrease occupancy levels in our lobbies and waiting rooms to comply with recommendations from the Centers for Disease Control. We encourage the public to conduct business over the phone with county services where possible. We have canceled non-essential meetings and trainings. County departments are preparing plans to provide essential services if the situation worsens. Human Resources and Development is working closely with department heads to help minimize the impact of sudden school closures amongst our workforce. We know that our employees have children in school, and we are doing everything that we can to help accommodate this sudden change in school scheduling and availability. We have also implemented a joint information center to streamline communications to our partners, healthcare providers, schools, businesses, and community organizations. In addition, a plug for our county assessor, Roland Hill, and our county auditor controller, Cass Cook. They have actually ordered the closure of their offices effective March 19th through April 13th to the public. They will continue to conduct their business, but will not be entertaining or opening to business from general members of the Tulare County public in order to contain and reduce the spread of this disease.
So at this time, we are going to take a couple of questions that we've had come in as we've been on the air. And I do want to remind you that this town hall is a public health meeting. We're just talking public health today. And we will have future town halls in which we'll have different guests on to talk about different subjects, but today we're really focusing just on public health. So this question came in, I have an autoimmune disease and my medication lowers my immune system. Should I stay inside? Should I have limited time out? My doctor hasn't said much on the topic.
Doctor?
Yes, I think that definitely I would be concerned with anyone who has an immunocompromising condition such as medication or for any other reason, as I mentioned, I believe in my opening statement. And so I would limit your outdoor or your interactions with other people if you can. It does not mean you cannot go out to get some groceries or such things as our director mentioned, but definitely would want to be judicious in what activities you do outside and who you're coming into contact with.
Thank you. This question says, I thought symptoms didn't show for 2 weeks. Should one still self-isolate if traveled 1 week ago?
This person didn't specify where they have traveled, and of course this is a rapidly evolving situation, so you never know exactly where the next hotspot's going to pop up. I think we now have more cases in California than in some of the other countries around the world that have been having cases, but yes, we have a 2-week self-isolation period or self-quarantine period for travelers who have been to one of the high-risk areas, and that's because it could take as long as 2 weeks to show symptoms.
Okay. Can someone who gets the virus become reinfected?
This is another one of those really good questions. I think the data is still out on this. I've seen some little preliminary reports here and there, but I don't think we have confirmed scientific knowledge on this for sure. Most viruses like this, you would develop some immunity to, and likely you would not get it again, but we're still going to have to wait and see what the data show.
This question says, do you have an estimated time for any type of mass drive-through testing?
Right now, I know that there's the hospitals, the clinics. We're all, communicating in terms of if it's inappropriate to do that. The thing is, even if we do have a type of drive-through testing, which I think to a degree they're using by setting up tents at the different hospitals right now and making sure that you call in and use that service to come through, you still need to be contacting them. You need to be meeting the guidelines or the requirements that would suggest that you do have the COVID-19 virus. So again, if you have symptoms of fever and a cough or trouble breathing, you feel you've been in contact with somebody, you've traveled from an area that is the level 3, and that indicates that you would possibly have been in contact with someone with COVID-19. These are the, I think, really nice preparations that the medical community has begun to develop so that we make sure that we test you safely and we can get you to the care that you need.
Okay, this is our last question of the evening. And for anyone who submitted a question to townhall@TulareHHSA.org and you didn't hear your question, we will address further questions in FAQ documents, videos, and future town halls. So if you submitted a question, we thank you very much. After this question, I'm going to go directly to last statements from each of the panelists, and then we'll have a sign-off from our chairman of the board. So this last question says, what is
contagious at the time, how close you were, and how much time you spent in that close proximity, and also the rest of the environment. So if you were outdoors, if you were just walking past someone in a grocery store, we don't consider that contact, or just passing through someone in the hallway. But if you spent time face to face within 6 feet of someone who is contagious, then that might be considered contact. And I think contact and direct contact are essentially the same thing in this situation. It's just we have a lot of people who call us with questions about, I know someone who now has been in quarantine and maybe you haven't seen them for a while, but now you're worried because you possibly have had contact with them. If you haven't been identified through contact tracing investigation, you probably are not at risk. And so we've been using the term, I think, direct contact to try to show that it needs to be confirmed in that period of time when the person would have been contagious. What was the second part?
exposure?
Exposure, exactly. So exposure means you were in that close proximity to a person who is contagious. So remember, when you first become exposed to this virus, the virus has to enter your body, and then it has to invade your cells and actually start growing. So this process takes some time. So you might say that when you first have that exposure, that could be day 0, and then through the incubation period for several days, you would not be a risk to anyone else. And so even if you were to come into contact with someone in the very early days after they were exposed, you would not be at risk. However, somewhere around day 4 to 6 is the average incubation period, and that person would then begin to show symptoms. They would begin to become contagious. And at that point, if you were exposed to them, you could be at risk of getting the infection.
And now we'll take your last statement.
Yes, so I just wanted to mention a little bit more about the testing and the drive-through testing. We touched a little bit before about how it's not terribly helpful to test people who don't have any symptoms yet, because they may still be incubating, as I just mentioned, or they could come into contact with someone contagious later on and think that they're okay, but then later on they actually become at risk. There's also an issue between testing kits and lab capacity. So we hear a lot about the testing kits because we know there was an issue with that early on. Our lab does have their testing kits now, but there's still a limit to the lab capacity. We just are not able to test everyone in the county at once. So that's why we're limiting our lab's capacity, our lab's criteria for testing to people who really are likely to have COVID-19. There are commercial labs available for people who don't meet our criteria and still really want to be tested.
So this was great. It's great to get the questions and be able to answer the community all the concerns. So please continue to send any questions you have. This town hall is a great way to answer a lot of the questions that are weighing on the community's mind. We understand we are wading through waters that are unfamiliar, but we are a resilient community, and it is important to support each other in these uncertain circumstances. The Public Health Department will continue to monitor the situation and provide updates as they become available. Please call your physician if you have symptoms of fever and a cough or respiratory distress. They will provide guidance on what next steps to take, or you can also dial 211 and they will connect you with public health staff. We have a call center available to answer questions you have. We will continue to work with our hospitals and medical providers to continue to work with this complex situation. The health of the community is our top priority. And as Chairman Vanderpool said earlier, be kind to everybody.
Well, I want to thank everyone for participating in this town hall, whether it was listening, submitting questions. I really do appreciate the engagement of this community. I think that is why we are here. We are here to serve and to make sure that we are helping to put your concerns and your unease to a bit of calmness. I know it is a very difficult and uncertain time, but we will get through this. We are a strong community. I think it is important to practice the general guidelines that have been laid out for you by the state and federal government, as well as right here in Tulare County by our Public Health Department. Be vigilant, be safe, be healthy, be sure to wash your hands regularly, and just do the small things that are going to help to keep Tulare County healthy and safe. As Karen mentioned, I think it's very important that we are kind to one another, and also remember that there are vulnerable populations out there within our county who may need some of these supplies that aren't on shelves in our stores anymore. And so please do avoid overstocking if at all possible. It's important to have a couple weeks of worth of supply, but remember, the world's not going to end. We're going to get through this. And so make sure that you don't buy more than you need so that others can take advantage and also have the supplies that they may need right now. So I want to thank you all for listening and for being here. Tulare County is a great place to live and to call home. I'm very proud of the great people we have working for Tulare County, many of whom are working around the clock, giving up a lot of their own personal time to make sure that their jobs are fulfilled and that they are providing the essential services that they do to our Tulare County residents. So thank you, Tulare County. This will not be the last virtual town hall, and please do stay tuned for those that will be coming in the future. I know those will be beneficial to you as well. Have a nice evening and stay healthy.
Claire.